So, good morning, everybody. And today marks 330 days since our first case, March 12th. And we are in week 47. Unfortunately, sadly, there are 4 new Albany County residents that passed away to COVID-19. 2 men in their 70s, a woman in her 70s, and a woman in her 80s. This now brings the total people that have fallen to COVID-19 to 328 since the outbreak started. My condolences and prayers go out to the 4 family members today and to all of them. And again, it's a difficult time, and yeah, I feel like a broken record, but I want to say this, and I hope someday I can sit here and report no one passing away to this. But it's hard enough to lose someone, regardless what they have fallen to, but it's even harder now these last 11 months because in the beginning you couldn't even have a funeral or a wake. Now you can, but it's limited, and you still can't send that loved one off like you would like to cherish their time here they spent with you. And again, my sincerity and my condolences goes out to the families. As of today, there's 18,830 cases of COVID-19 in the county to date. We have an increase today of 121 positive cases since yesterday. This now brings our 5-day average to 105.6. Yesterday was 112.8. There are currently 2,394 people under mandatory quarantine. Yesterday, that number was 2,511. And of the new positive cases, 24 had close contact to a positive case, 6 are healthcare workers, and 91 don't have a clear source of infection at this time. 56,623 people now have completed quarantine. 17,687 tested positive for the virus and had recovered. Good news. We do put it out. Dave, please pay attention to our guy that keeps asking that same question. We have put it out. That's an increase of 191 recoveries since yesterday. And there's 8 new hospitalizations overnight, which is probably the lowest we've been in a long time to have 8 people. There are now 112 people currently in the hospital, and I don't think we're there since January 1st was the last time we had 112 people in the hospital. So, but unfortunately we did have 4 people pass away. There are currently, actually the number was 126 yesterday, so you go down, that's good. 15 patients currently in the ICU. It was 16 yesterday in the ICU. But I do want to clarify some of the things. I was happy to see the number of people getting tested increased. Again, there were 2,997 tests given on February 3rd. The 3 days between January 1st and February 2nd, we had an average of 1,324 people get tested, which brings our numbers down. If you got positivity, if you got people that are positive, it brings our rolling average up. So, that was one of the things that we were alarmed about, but it's going back up with the snow. It kind of shut down, and now people are back getting tested. We were hovering around 4,000 tests a day here in Albany County, so imagine when that drops. But one of the things we continue to watch, obviously, is the hospitalizations, and thank goodness Dr. Reed and St. Peter's partnership didn't have to open up the hospital up at our old nursing home. But I want to talk about people passing away. In the month of December, we lost 66 residents, and the average was 2.13% per day. January 1st through the 31st, we lost 89 Albany County residents. It was 2.87%. So far, for the month of February, we're averaging 2.2%. So our death rate is still continuing to grow. I knew December was going to be tough. I knew January was going to be awful. And I was hoping February that would start to come down, and it's not. We're seeing hospitalizations come down, but people still passing away to this. So, it's still alarming. So just when you look at our 7-day rolling average, on February 3rd, our percent positive rate was 5.4% for that day, and it brought the county 7-day average down to 4.9. So that's good news. That's going down. On the capital region standpoint, it's 4.2, which is all good things. So please continue to socially distance, continue to cough into your arm, clean your hands, and stay 6 feet apart. I know it's been a tough 11 months, but we still probably got another 4 or 5 months ahead of us. And we'll get through it together. It's a marathon, not a sprint. For those who want to get the vaccine or check their eligibility, please continue to use the state's website. Their hotline 1-888-697-4829 and the 211 with United Way, Pecan and United Way. Thank you. And as we encourage to get vaccine, we had that great partnership with Mayor Sheen and the City of Albany and Mohawk Ambulance and a lot of other partners that made extraordinary things happen to get vaccine into vulnerable residents here in the City of Albany, Cohoes, and Watervliet today, but going into housing. And, you look at how the operation went, it was really Mohawk Ambulance first time setting up mass vaccines like this. And lessons learned, how to do it better, what went right, what went wrong. We look at everything like when we get to these two college doctors and presidents of the respective colleges, it's the same thing. You have to adjust. And, Mayor Sheen sent me a text last night, probably, 10 o'clock, and, I almost really want to cry. And she was talking about, the good things that went good and the bad things, but she said one thing broke my heart. And there's a 64-year-old man, stage 4 cancer, was denied the shot yesterday because he wasn't 65. And, you sit there and I just kept looking at it and, I felt like just bawling because this is what we've been advocating for people. I know people want to get the shot. We want to get you the shot. We want to get the shot into every arm that we can. There's a population of people out there for some reason are falling through the cracks. Please, if you didn't read it, read Chris Churchill's story in the Times-Union yesterday. It summed it up. I want to thank my colleagues, Assemblywoman Pat Fahey, John McDonald, and Neil Breslin, Senator Breslin, for putting that in, Assemblywoman Warner, I believe, for sending that letter into the State Department of Health to clarify this. We need to address that. And, when I'm talking to the Kathy Sheen, and she is the mayor, but we're going back and forth, and we were joking yesterday how we talk a lot at night. And I'm like saying to my wife, yes, it's the mayor. It's the mayor on the phone I'm talking to. It breaks your heart, when you sit there and you're like, why is this happening? And, you got to remember, people say, well, just give him the shot. You have a medical doctor like Dr. Whalen oversees our pods. And there's protocols and guidance from the state DOH that we have to follow. And if we go outside, when they say we can't do above 65, if I do someone over 65, I have the potential of $1 million fine and loss of vaccines going forward. So when you have that type of guidelines, they're afraid to move. And in the beginning of this, when we talk about shots in arms, they're like, well, we don't want a shot wasted. People are afraid to go outside that class because the last thing I want to do is sit here and say I lost my vaccine next week because I did a 64-year-old man with stage 4 cancer. This is the stuff that keeps us up at night. The mayor and I and everyone else and Dr. Whalen. Please, I hope DOH straightens this out and this continues to stop. But that's just, again, unfortunately, one of many stories. So hopefully that gets rectified and we can get guidance so that you can do that. And if you have someone like that, you can get that shot in that person's arm to help them get better. Switching gears, I've had college presidents over before, talking about different things and how college life's differently, how dorm life's differently, how you have to retrain the freshman class coming in, seniors that graduated and didn't get that last year of their senior year, and I know in sports programs that you're running and everything else, the arts, it's been a tough 11 months, and it's tough for a lot of these college kids that start their freshman career and have to do things differently. And, it's like, that freedom. William Wallace, you break out of the house and you're going to school and you're like, this is freedom for them. And the first time they can just go out and, unfortunately don't get hurt, fall down, dust off, and readjust if they do some things they shouldn't have done. But the reality is this, it's a partnership. So I do want to thank Russell Sage and Maria College for joining me today. They've been fabrics of our community for a long time before Russell Sage has a presence over in Troy as well as here in Albany. My wife actually graduated when it was a JCA, and a lot of great history and with both colleges and being backbones here in the city of Albany that have a lot of people that come through their doors and live here in the city of Albany, that not just dorm here, but have apartments or housing, and or they're continuing on with their higher education. So I want to start with Dr. Ames from Russell Sage. Can you talk about how your college campus, the location both in Troy and Albany, how you responded to this, how you're dealing with online learning versus, I know you offer both, you always have, but to some of the challenges that you have and the challenges that you got going forward now with everyone coming back. Thank you.
Sure. Thank you, Dan, and good morning, everyone. Russell Sage College is very proud to be part of the diverse group of colleges that are in Albany and the Albany area. As Dan said, we've got campuses in Troy. We've been in Albany for 50 years now with a 4-year college. And we're also particularly proud of the fact that we have, through the whole course of the pandemic, managed to operate without any layoffs or furloughs, so doing our bit to help keep people employed in the Albany area. I think most of the colleges here have had a successful fall semester, being able to operate and educate students under the conditions of the pandemic. We had, I think, a successful fall where every student who wanted to study in classes on campus, who wanted to reside on campus, was able to do that. We didn't have to interrupt operations. We got 2,300 students, about 500 faculty and staff between both of our campuses. In the fall, we had 38 cases, 36 students, 2 staff, no hospitalizations, no sign of transmission in the classroom or in offices. And so that's encouraging, I think. And a part of our success is due to the same stuff that everybody does, right? You've got to have the de-densifying so you can social distance. You've got to have people masked. You've got to have the hand washing and the sanitation. But I think there's another story here, which is that each institution has its distinctive strengths, and leaning into those can make a strategy that works. The couple things I think of that are important with Russell Sage: we're a small institution. We like to think of ourselves as a small college that makes a big difference. But some of the things that was meaningful in the pandemic, our residential students are all in single rooms this year. That means when we have to quarantine, we don't have to move them. We just deliver food to their rooms. They switch to remote education. It's much easier to manage. We also trained our own contact tracers, so they assist the county, but that means we were able to get contact tracing done within 2 or 3 hours of a positive and get people secured. The other strength that we have, and this we have in common with Dr. Gamble and his institution, Maria, who's here today, is our biggest programs are in nursing and the health sciences. We've got graduate programs, undergraduate programs, OT, PT, nutrition, public health, and nursing, which means we have a lot of students on campus where hand washing and mask wearing is actually part of their curriculum. They learn it in class. It's part of their daily clinical practice. And I think they set an example for our students, so we had a high degree of compliance. As you say, college students, it's not a 100% degree of compliance, but they worked hard for making sure their educational experience would continue in an environment that's pretty different than what they imagined, I think. So the other thing that's been important to us, and Tom may talk about this too, is we've been able to collaborate with other colleges. Maria and Russell Sage worked along with Albany Law and Albany Pharmacy at the very early stage when pharmacy had access to tests because they're a licensed pharmacy, and it was harder for us to get, and that's a great partnership that really helped us out. The question we all have now is we're in spring semester. We started January 25th. We know there's just more COVID around, and it's not as easy of an atmosphere to operate in. So we've added a few things. We're doing surveillance testing now, about 900 to 1,000 tests a week. And we think that'll be a big help. We have applied and been accepted as a vaccination site. Whether, if or when we will get doses, that we don't know. That's way above my pay grade. It's the federal government and
Mine
the state.
too.
But we all have the same goal, right? We want to get those vaccines out, and if Russell Sage can play a role in our Albany campus and our Troy campus, working with the adjoining neighborhoods, we have our nursing students and staff who can assist with that. We are ready to help in whatever way we can, just as last summer, our repurposed armory, which is on New Scotland, part of our Albany campus, we turned it over to the National Guard, and they used it for assembling test kits that were made at Wadsworth Labs. I think everybody's looking for how we can pull together. And I guess the last thing I would say is, we're an educational institution, and there's so much suffering with the pandemic. There's so many things you can say about it, but it's also a profoundly teachable moment. I've never known a part of my life when it was so clear that what individuals did makes a difference to the common good. And I think for our students, that's a lifetime lesson that they'll take from this. And I'm really pretty proud of the work our faculty has done, and staff and students, to keep us operating under really pretty difficult conditions. And we pay attention to these briefings. We try to amplify those messages with our community because we think it's really important.
Dr. Ames, thank you, but I'm glad that you brought up the testing for the pods. Are you going to be strictly doing it in Troy or both campuses, Troy and Albany?
Well, the testing we have on both campuses right now. If we are given doses, we have the capacity to do that in both Albany and Troy.
I'm glad to hear that. I didn't want to have to call up Steve and yell at him, but I appreciate that. So, again, great partnerships doing extraordinary things on both sides of the river, in which that's what we like. It's a partnership, and without working together, we can't get things done. So, Dr. Ames, thank you for your leadership of the college, but importantly, thank you for your leadership into community, because that's a good thing about these two colleges and all the colleges in the city of Albany. And Albany County is that they are a fabric of our community. And, if you look at, they're not just used for the college students. I know when Russell Sage is open normally, they'll let neighborhood meetings go on in there, different things go on in there. Same thing with your campus at Maria. You can have neighborhood meetings there. And so you are a fabric of the community. So thank you for everything that you both do. But, I look at Maria College, Dr. Gamble, and, you think of it primarily for nursing. And I like, one of the exciting things is that my youngest now is taking nursing, and that's what she wants to do. But most importantly is the fact that how they've gotten on, if you want to talk to about it, and I think this is really good, the hands-on experience, how they're volunteering, how they're working at the hospital, and through these, they're probably coming out more battle ready than any nurse that has graduated from Maria College. No offense to the other nurses, but they're getting this experience more so, not just in the classroom, but hands-on, if you'd like to talk about that.
Sure, thank you. Thank you very much. I appreciate the invitation. It's nice to be here with members of with the media, with President Ames, and of course with yourself. I want to just thank you for the really competent and compassionate leadership that you've shown through this. I mean, just the information that's available, I think, makes people so much more relaxed. We can't control things, but at least if we understand what's going on, that makes a huge difference. So appreciate that very much. Maria's a little different in many respects, but we don't have residence halls. We don't have dining halls. We don't have athletic teams. Our students are largely 85% women. Most of them are part-time. They're transferring from other places. They have jobs. They have children. Our job is to get them educated in a career where they can take care of themselves and their families, get on with their lives. And we have, just like all the other schools, pivoted to more remote and all that. But the labs, the skills labs in nursing and the science labs, they have to be in person. And so we've arranged that. We do surveillance testing. We tested everybody when they came back for the spring. We have very low transmission rates where, we've had since March, we've had 21 positive tests, and that we've tested everybody at least once, and most people more than that. So it's been a good experience for us, and we've been in the nursing business a long time, but we come also from a heritage of nursing, right, with the Sisters of Mercy. Mercy nurses were in Crimea with Florence Nightingale. And she has elegant letters about how wonderful the Mercy nurses were at that time. So we've been in the business a long time. We've educated something like 5,000 licensed nurses who work in Albany over the last few decades. So And we have right now, we have 90 students who are at Albany Medical Center, at Whitney Young, at that pop-up they did at Sweet Pilgrim Baptist Church, at Ellis, at Glens Falls. We have nursing students everywhere doing testing. It's a great experience for them. They are battle hardened as a result. And so, we're very proud of, it's our job to support and serve the community. We're founded by Sisters of Mercy. Of course, that's what we're going to try to do to the extent that it's possible at all. And, and that partnership that we have with SAGE and Albany College of Pharmacy and Albany Law I think it's just really important as an indicator about the future of higher education. I think partnerships are going to become increasingly important, and we also have a partnership with Siena and others. So, Maria is doing all right. We made our pivots, our enrollment's holding, our nurses are helping the community. We're trying to live our mission to the extent we possibly can. So thank you for the opportunity to say a few words about Maria and be here this morning. Thanks.
Dr. Gamble, thank you, and Dr. Ames, both for your leadership at your respective universities, but for the community. And the one lessons learned that you can take away from this is really what you do day in, day out, just not as college presidents, but how you intertwine with the community as whole. I know we get quality of life issues and nuisance, college students, all that, but really you are a big part of the city of Albany and of the county. And so again, thank you for what you're doing. Thank you, both of you, for wearing red ties, because today is American Heart Association Awareness, and just want to say this, it's important for women, because heart disease is the #1 killer of women. And thank you for wearing red, because 80% of women that have heart disease is curable by going to the right doctor and by getting properly medicated, eating right, and exercising and everything else. So I got on a nice Zoom call last night. It was nice to hear the stories and the good outcomes. But again, thank you to two presidents here for wearing red ties, and myself, and Mary wouldn't let me come in without a red tie. I think she was going to buy one for me if I didn't have it. But I do want to say thank you, and again, for Maria College for what they're doing, and they're volunteering, the students that are volunteering their time to help out with the pods and the different different stuff around the county, and again to just the students in general doing the right thing, because we're all in this together. I also want to take a minute and thank our DPW crews for the storm cleanup earlier this week. We got a lot of emails and social media thanking them for what they're doing. So please appreciate the men and women out there at our DPW getting the job done and keeping the roads clean and safe for our residents to travel on. Again, we encourage people to continue to get tested, whether they have symptoms or not. If they're worried they had exposures, or if they feel that they meet one of the requirements, please go and get tested. I know some people were joking around on I don't know if they were joking on our social media, saying, "Oh, now would I just wake up and go, I feel good, but I'm going to go get tested?" No, it helps with the epi. It helps us map and trace this and see the domino effect. And if we see clusters starting to come in, just because you feel great, and I hope everyone, if you do get it, and I hope you don't get it, but if you do get it, I seriously hope you have no signs or symptoms. I truly mean that. But it helps our Department of Health do their job if we start to see an outbreak or cluster. That's why you see these two great presidents testing at their respective colleges. That's why you see, Chancellor Malatras doing the same thing in Albany Law, and the rest of them doing the same thing in pharmacy to make sure that we're safe in Siena College. So I hit them all right this time. St. Rose, don't want to get in trouble with her again. The reality is this: we're in it together, and the more that you just go out and get. I'm not saying wake up every day and get tested. I'm just saying just go out and get tested every now and then, people around you, so we know where it's at. But testing's available. It's free if you don't have insurance at both U Albany and Whitney Young. Whitney Young's number is 518-465-4771. And the University of Albany, that the governor's done a great job setting these up around the state, 188-364-3065. You can always go to albanycounty.com, look at the testing requirements, age requirements, and wait times and so forth and so on. Please go there. As always, mental health is a huge issue. It's really huge, and please, people, take time with your kids. Talk to them. Remember, they're on edge. Even a 6-year-old's on edge, or a 5-year-old. The world's different. Especially, it's bad enough when you tell your son or daughter they can't play with the kid next door, and they don't understand why, and they're never going to understand why they can't just go out and and then have to wearing this at a young age. So please take the time. It's available 8 a.m. to 5 p.m. 518-269-6634, our 24-hour sexual assault line. Please call there if you have to. We set up on an app. You can text. You can email now. You don't have to call, especially if you're in a situation that you don't want unfortunately, the person that's doing this to you hear what's going on. 518-447-7716. It's available Monday through Friday, 10 a.m. to 2 p.m. and 4 to 6. At the different times. So again, please call 211 United Way or New York State hotline number at 188-364-3065. I also do want to make a good announcement, and I know Bob Elber's going to be putting this out later on, but we just got award at the high school wrestling for 2023 to 2025. Which is good news, so that the champion, all that will be done here. So, and we got some other great announcements we will be making about the TU, and as we continue to open up.